Good day, everyone. This will be the continuation of my review in Neurology. Finished off last night, page, page number 19, and this would be, I'll be continuing my review at page 20. It talks about seizures. Okay, so what are seizures? Seizures are not a disease in themselves, they are a symptom of an underlying disorder. Epilepsy is a disease, a neurological disorder marked by sudden, recurrent episodes of sensory disturbances, loss of consciousness, or convulsions associated with abnormal electrical activity in the brain. No underlying disorder. No other underlying disorder. So when I think about epilepsy, it's more of seizures, and there could be other symptoms, but main or marked symptom would be seizures. Classification of seizures: there's partial and generalized, focal and non-focal. There's simple and complex, and they're partial. And the non-focal is tonic, clonic, myoclonic, absence. Partial is limited to a specific area of the brain. Okay, that's why it's partial, only a portion. Generalized involves the entire brain. Okay. Simple, no loss of consciousness. Complex, impaired consciousness ranging from confusion to non-responsive. So there's partial, but also subdivided to simple. There's a loss of consciousness, and then no loss of consciousness, and here complex, impaired consciousness. For the generalized, there's tonic, clonic. So let's check what's. I remember it's tonic and the clonic. Okay. Tonic and clonic seizures involve both stiffening and twitching. Okay, so it's tonic, it's stiffening, while clonic is jerking or twitching, which you would normally see in epileptic patients. So tonic means hardening, clonic twitching or jerking, myoclonic sudden brief contractions of a muscle or group of muscles. Okay, absence, loss of consciousness, staring off into space. Okay, so there could also be type of seizures when there's no tonic or clonic episodes, only loss of consciousness or staring off into space. Treatment would be anticonvulsant since um, their seizure episodes. The treatment would be anticonvulsant. Rapid acting, long acting. So rapid acting, it could most likely be like the lorazepam is the immediate at the onset of the epilepsy. This could be for chronic, or let's say after once the client is stable, they could be administered the phenytoin for the maintenance. Very important to monitor for therapeutic levels. So they have a very low therapeutic index. Never stop taking suddenly can cause seizure. So just like with psychiatric drugs, mm, the patient really has to taper the administration of these medications. Never stop taking suddenly, else there will be a rebound seizure. Mhm. Seizure precautions. Oxygen and suction apparatus available. Okay. Privacy provided as soon as possible. Side rails, okay, for safety. So epileptic patients, the main concern is safety. It's because they're jerking off or twitching. Pillow under the head, bed in lowest position, patient inside lying, immediately post seizure. So it would facilitate drainage. Side rails up, padding not shown to allow for see-through effect. Okay, so there would be side rails here, side lying towards the right. And oxygen. NCLEX question. Seizure precautions have been ordered for a client admitted to the psychiatric unit. Which of the following nursing interventions is not appropriate when initiating seizure precautions? Select all that apply. So this is a SATA question, and the question is asking for a negative intervention or not appropriate. So I would expect uh, the not appropriate would be unsafe practices. Okay, so let's read the options. Pad the side rails of the bed, lower side rails where the client sleeps. Okay, so here I would immediately eliminate this because it's still a possibility that the client may have a seizure even if they're sleeping, and this would put the client safety in question. So A is check, B is no. So I would say since the question is about not appropriate, I would answer one. This could be one possible answer. Okay. Remove hard or sharp objects from the bed. This is an appropriate intervention, so this wouldn't be an answer. Use 4-point restraints to prevent injury. I am not familiar with 4-point restraint, but it says prevent injury. So I think it's an appropriate intervention. So I'll go back to this later. So far I have B. Mm-hmm. Okay. Adhere a fall risk bracelet to the seizure prone client. This could be, yeah, I would say this is appropriate. Ask the family to monitor the patient 24 by 7. The client is admitted to the psychiatric unit. I wouldn't expect the family to monitor them 24 by 7. So I would say this is a not appropriate nursing intervention. So far I have B and F. I'll go back to use 4 points restraints. I don't know what's 4 point. Maybe points in the body. It could be from the upper and lower extremities or the limbs. But I would say it's inappropriate, so my answer would be B and F. Let's check. Oh, there's no answer. Okay, let's go back to the. Hmm, what's letter D? Okay, so I'm wrong. So they use 4-point restraints to prevent injury. Okay, let's check the answer. The correct answers are B, D, and F. Padded bed rails should remain up while the client sleeps. Okay, so that's letter B. Patients should be provided with a call light so that they may call for help if needed. 4-point restraints are not appropriate for a seizing client and could result in injury. It is not appropriate to ask the family to monitor. Yeah, I know. I realize now. Restraints should have been avoided for seizure or for epileptic patients or seizure patients, because once it's the client is because the patient is moving, and if you put restraints it could really result to injury. So I agree, even if I don't know um, the 4 point, just the keyword restraints should have prompted me not to pick that as an appropriate nursing intervention. So it should have been not appropriate. So I agree with the answer. D should have been included. Choice A is incorrect. When initiating seizure precautions, the nurse should ensure. Okay, yes. It's incorrect in a way because it's an appropriate nursing intervention. All sharps, okay. Of course, it's one of the precautionary measures to prevent further injury. Patients prone to seizures should wear a fall risk bracelet to alert members of the healthcare team to the client's needs for increased supervision. Okay. All right. So for this question, it's settled. It's B, D, and F. This is not appropriate. Shouldn't be the patient's family. This should not be done. It exposes the patient to falls, and this one should just for just because of this restraints. Even if I don't know this 4 point, I should have answered D as well as not appropriate. Okay, let's proceed to the next one. Seizure precautions have been ordered for a client admitted to the psychiatric unit. Which of the following nursing interventions is not appropriate when initiating seizure precautions? Select all that apply. So similar to the other one. Hmm. Okay, so it's the same question. What's the difference? Seizure precautions. Which of the following nursing interventions is not appropriate? Oh, it's the same question. So here, they just highlighted the not to emphasize what's being asked. So the what is being asked, you really have to go back to what's the question is all about. This is a negative uh, phrase, not appropriate. So the answer should be negative as well. So right now I'm trying to train myself to before I give my final answer, to go back to the question, I think most of the answers uh, in questions like this are obvious, but if we don't go back to the what's being asked, we would miss the correct answer. So I try to be systematic as I review moving forward. All right. So what is Parkinson's disease? Progressive nervous system disorder caused by degeneration of dopamine neurons. I remember Parkinson's because I have a relative who died of Parkinson's. So we have a family history of Parkinson's, and she, her limbs or extremities were moving. It's because of dopamine. Yeah, dopamine neurons. The impact is here. In Parkinson's patients, dopamine neurons in the nigrostriated pathway degenerates. And so since this portion of the brain is responsible for uh, movements, uh, there is the symptoms are mostly movements are affected. Yeah, there's tremor, akinesia, no, tremor, shaking. So the shaking, usually starting on one side, rigidity, stiffness of the limbs, neck or trunk. It's a trap. Okay. Akinesia, loss or impairment of power or voluntary movement, posture and balance. So I think uh, we have here cerebellum, and there's it's responsible for posture and the balance. It's possible, like in an advanced stage, this could also be impacted. Akinesia, so there's an impairment of voluntary or impairment in power of voluntary movements, automatic twitching, stoop posture, masked facial expression, and they're really involuntary. They can't help it. Forward tilt of trunk, reduced arm swinging, fixed elbows and wrists because of the rigidity, slightly flexed hips and knees, most likely because of the balance and I mean that portion of the brain where there's an impairment of the dopamine. Dopamine is a neurotransmitter. Trembling of extremities. Okay, there's trembling, and there's tremors here. The arms would normally notice the tremors. Intervention, so just like seizure, safety is of high priority. Fall risk, there's no cure, just therapy. PT, OT, SLP, the language, carbidopa, levodopa, increased dopamine in the brain. So if carbidopa or levodopa increases, so that means in uh, Parkinson's there's a decrease in dopamine. So there's a normal level, but it's not functioning properly, or there could be a decrease in dopamine, and carbidopa increases the levels or dopamine in the brain. Mhm. Carbidopa, levodopa. What is yes, MS, multiple sclerosis. So this time it's an autoimmune disorder. There's an inflammation. Whenever there's an autoimmune, uh, there's normally inflammation involved, damages and degrades the myelin sheath surrounding neurons. So since it's an autoimmune, it's the body is attacking itself, and it happens to be myelin sheaths. Demyelination. So the myelination, there's no longer sheets that protects or that envelope the nerves. These ones. This is a healthy nerve, and demyelination in progress. See, because the body is attacking itself. Common symptoms of MS: there's fatigue, depression. I think it's all over the place. Um, Fatigue, depression, vertigo, vision problems, and since it attacks and nerves is the fundamental unit of the nervous system or neurons. So if there's demyelination, most of the function or almost all of the functions of the neurons would be impacted. Cognitive dysfunction, muscle related symptoms, bowel and bladder symptoms. So these are even sexual dysfunction. Uh, the common functions of the brain: fatigue, depression, vertigo. So even the balance is impacted. Vision problems. So the nerves, optic nerve, cognitive dysfunction. Because of that demyelination, uh, the there's a problem in transferring signals. Intervention, also there's no cure, just like Parkinson's. Only therapy or only symptomatic corticosteroids to decrease the inflammation. Plasmapheresis. So what is a plasmapheresis? Removing blood through a needle or catheter and circulating it through a machine where the blood is separated into red cells, white cells, platelets, and plasma. The plasma is which is the fluid content of the blood, is discarded and replaced with a substitution fluid. So, what does it have to do with uh, multiple sclerosis? second line therapy after systemic corticosteroids, the management of MS attacks or relapses. The other central nervous system, hmm, people with some forms of MS use plasma exchange to manage sudden severe attacks, sometimes called relapses or flare ups. Their plasma could have certain proteins that are attacking their own body. When you take out the plasma, you get rid of those proteins, and symptoms may get better. Okay, it makes sense. Since the plasma contains the antibodies and and that those antibodies in plasma are the ones responsible for attacking itself, for that for attacking the body or the nerves. So if you remove them, it's possible that that batch is the one causing the autoimmune. So if you remove them and substitute with a different substance or uh, supplement with another or replaced with something else or then it's possible the symptoms could be relieved, right? So right now I'm just trying to make sense of why it's being done in this kind, since the body, let's say within the body, it's the in the plasma antibodies are uh, in the plasma, and so if you remove the plasma, then the antibodies will no longer be the cause of attacking itself. So the body might generate or produce plasma again, and it could be a different set of antibodies, which could be uh, which may not attack or prevent the autoimmune disease from progressing. So and since these are being done during flare-ups or relapses or attacks, then getting rid of those antibodies could help, and it makes sense. Okay, so aside from multiple sclerosis, we also have myasthenia gravis, another autoimmune disease. Communication between nerves and muscles destroyed. Diagnosis. Yeah, so I remember this tensilon test is the diagnosis for or diagnostic test for MG, myasthenia gravis. So the difference between myasthenia gravis and multiple sclerosis in MS, there is demyelination of the nerves. So most of the or if not all of the functions of the brain are impaired. Specifically for MG, myasthenia, which is muscle, asthenia is weakening, and so the communication between the nerves and muscles are destroyed, and supposedly the nerves from the brain, uh, it goes down to the nerves, which would be the pathway. So the one ordering all of those signals or commands coming from the brain goes to the nerves through the nerves, then go to the different organs or systems, and one of them is muscles. And so in myasthenia gravis, there's an absence or lack of uh, communication between the nerves and muscles. Hydrophonium injection, muscle strength improve, possibly myasthenia gravis. Not improve, muscle weakness is due to other reasons. So I bet this one is like a supplement that when you inject, so let's say there's a lack of communication between the nerves and the muscles because of MG. And the diagnostic procedure or test is if we inject hydrophonium and the strength improves, it's possible it's myasthenia gravis. If it doesn't, it could be caused by something else. So the tensilon or hydrophonium test uh, is the diagnostic procedure to confirm uh, myasthenia gravis. Here, there is weak muscles. There is weak muscles because the nerves supposedly should be instructing the muscles to act accordingly or appropriately. But since the communication is hampered, then there would be drooping eyelid or ptosis. It's really mainly the muscles. Interventions, corticosteroids, immunosuppressants, cholinesterase inhibitors, and immunosuppressants. Since this is one of the autoimmune, so aside from plasmapheresis, uh, I'm not surprised that they would be administering immunosuppressants. Immuno meaning still the antibodies. So if you suppress them, then they might not attack the body that they're supposed to protect. However, if you administer immunosuppressants, you lower down the defense mechanism of the body to those pathogens, and so there's really have to be some kind of safety and security or uh, measures to protect the patient uh, from catching opportunistic pathogens or other microorganisms or germs. Okay, so that concludes the neurology lecture. I would say there in in the actual exam there could be like two or three questions in NCLEX about neurology. So I just need to remember those terms and the signs and symptoms assessment. Uh, Stroke, and I would have to I would have to look more, I mean, deeply in the pharmacology. Once I start pharmacology, this would have uh, like the nursing interventions, the side effects, the adverse effects, the common side effects, what to watch out for, and basic nursing assessments, and what to expect and how to treat patients in relation to neurology. So I think overall, I would say, since this is my first lecture review, I'd have to I still need to read more, and start integrating all the topics all together, just so whenever there's a question, I would be able to pick up what I've read from the lectures and apply it to the questions. Because even if I would have test taking strategies, if I don't know nursing, I don't if I have um, if I don't have enough nursing content, it would still be not effective. So lecture would be, it is a must have, I would say, in review. And documenting these in a vlog, number one, it helps me not to fall asleep. It's because whenever I just read and without talking, I would suddenly fall asleep. And second, hopefully there would be someone who's like me, who've been out of nursing for a very long time, and this would be their first time as well to go back to the profession. This pandemic has caused a lot of troubles and changes in our lives, and I've seen patients, even if I've not been practicing. I have relatives, friends that I wanted to go back, and this is just a test of discipline. And I would say this is really a test of discipline. How to make sure that you stick to the review strategies, review schedule, amidst the all of the nuances of living a life at this age, with family, with work, everything. So that's it. Thank you for your time. I will see you in my next video. Thank you.